Hey everybody, welcome to Regulatory Joe. I'm Joe Boyle, president of ClearFile, and today we'll be talking about Market Conduct Annual Statements, or MCAS 101. A market conduct annual statement is an annual data call that is issued by the NAIC, or the National Association of Insurance Commissioners, to an issuing organization. And that could be a health insurance company, a property casualty company, or any other administering organization. In the context of this, we're going to focus on health plan organizations. Well, eventually, every issuing body will ultimately get an MCAS audit or an MCAS call letter. Carriers do not have to participate in this process on an annual basis every single year. On an annual basis, the NAIC and respective regulators will look at certain criteria that's published and filed by health plan organizations to identify certain trends of claims, financials, or other key activities that's important for that particular state. Based on that criteria, the NAIC and those respective regulators will set thresholds. And once that threshold has been established, that is a baseline that's used for additional annual call letters issued to other health plan organizations. The annual call letter has a number of instructions, including criteria and information that the health plan must furnish within certain timeframes that they will submit through the MCAS system administered by the NAIC. Within each criteria, there are numbers of questions and oftentimes dozens of questions within each subsection that carriers must farm out to additional subject matter expert stakeholders within their organization to collect respective materials that they need to respond to the annual call. Some of the materials could be business policies and procedures, making sure that the NAIC knows that their health plan organizations are documenting their business processes, so they actually have policies that are updated and version controlled that employees current and new can use when they're onboarding and or offboarded, all the way down to requesting extensive subsets of claims information, financial statement information, and information about your membership. And recognizing that each health plan carrier uses different data warehouses that could be interdepartmental across many different work streams, this data could take a long period of time to find, collect, validate for accuracy, and then submit back to the NAIC per the MCAS timeframes. So it's really important to know when an annual call letter is issued, the response letter needs to be mapped to a certain format that's required by the NAIC. When we talk about data collection and mapping, essentially understanding where your data is housed within your organization will be critically important because of how standardized the MCAS templates are when you go to actually submit to the NAIC. And with the validation functions of these standardized templates, it's critically important to get it right the first time. When a data call letter is issued and received by a healthcare organization, recommend assigning a dedicated project manager or a single point of contact to establish a working group to notify all of your stakeholders impacted and also bring them together to identify the scope of the entire review of the actual letter itself. Generally speaking, you should be able to parse out the subsections pretty quickly into a couple key functions, whether it's sales and service, product and benefits, finance and actuarial, and claims and analytics. Generally, those four buckets are where you can get the most of the information from your call letters in partnership with your leadership. In some cases, you may need senior officer attestations or some signatures, but generally speaking, you should be able to farm all the requested information within your day-to-day working teams. The NAIC and the MCAS letter will provide you with codified timelines and deadlines for submission. Would recommend also wrapping around internal target due dates to actually collect the materials required of your business partners to hold them accountable, making sure they're giving you their materials up to 2 weeks ahead of any submission due date. So in terms of timing, how the actual submission process works is the call letters on an annual basis are released to carrier organizations around the December timeframe at the end of the year. Carrier organizations then have roughly 6 to 7 months until about April and May of that following year to aggregate the data or do the data collection for the actual submission, which occurs through the NAIC MCAS portal itself. After the submissions are made, regulators are actually taking the data collection from the call letter that they got from the carrier organization and reviewing them against those benchmarks and thresholds for that given state. So whether it's claims volume, whether it's member complaints that either went straight through the carrier or through a state ombudsman, or any other criteria from that letter, they're going to be evaluating it against those benchmarks. During the review process, regulators will spike out outliers that don't meet the normal benchmark that was established at the beginning of the call letter. Those outliers, if flagged, will get extra scrutiny upon review and could result in a formal market conduct exam. As regulators are identifying these trends and outliers during the review process, they do then have the opportunity to create new rules and regulations as a result if they deem necessary. So what happens if you do get flagged by way of outlier review for a conduct exam itself? A market conduct exam begins with a data request for the last 2 calendar years of your MCAS data. The first thing any organization should do is assign a single point of contact, like a project manager, whether it's somebody internal to your organization, or if you don't have the resources, sourcing a supplier external to your organization to manage this project and process, and engage your cross-functional stakeholders specific to their business areas. Now, I know we covered having representation from your claims and finance area, but a formal market conduct exam will also include a far greater reach across your departments, including utilization management, care management, your product and benefit teams, and more. So making sure that they're aware with the criteria, the instructions, and timeline will be critical. And establishing that work group, generally on a weekly basis throughout the preparation and review process, will help you harness the timeline. The call letter will have a number of criteria that you have to collect. So assigning that and delegating ownership, we recommend specific single accountable owners by work item. Not to say that there could be other folks helping out to actually gather that data, but it's critically important to having one accountable owner by function. So you can have that subject matter expert to help you respond to the NAIC questions. If you're flagged, you were flagged for a reason. So they're going to be asking, it's very clear that the NAIC and regulators will continue to ask second, third, or even fourth layers of questions on those questions that popped out during the letter call. As your work group forms, we also recommend building standard business operations and policies and procedures. If you don't have the business processes written down, chances are they're required for the market conduct response anyways. So if you are missing policies and procedures, we recommend you document them along the way, making it a core part of your day-to-day. A couple other best practices issuers can do to prepare for these types of audits is to even review ratios prior to even getting a formal market conduct statement by reviewing internal, just general criteria that they request from carriers. So by understanding claims volume, just at a general basis, incorporating these types of reviews into your day-to-day, we'd recommend, even if you are not subject to a formal audit, taking a look at your data on a quarterly basis, just making sure internally if you can determine if you have any outliers that could cause an audit at a future state. That preventative maintenance will not just create financial savings, but non-financial savings as well for your organization. And we also recommend that if you do utilize current technology within your plan day to day, bringing your technology up on an enterprise level within your issuer is also a wise decision as well. Shameless plug, we've been very successful with ClearFile and our carrier partners to track codified workflows for any submission that goes to a regulator, including the MCAS workflow. Having everything in one centralized repository and location has been highly valuable, especially with the data and security for our plan partners. I'd encourage everybody just to take a quick step back and just think about the project as a whole. Working in collaboration and over-communicating with your stakeholders and your centralized project manager is going to be key. Far too often, wrong versions are submitted, resulting in net new questions that didn't exist before from regulators. The last thing you also want to do is have to request an extension up against a deadline after you've had 4 to 6 months to actually complete a submission. So some may say not having the resources, that the NAIC doesn't allow issuers enough time to complete or respond to an audit. But really, if we're organized and we prepare the right way with the right health technology systems to support as a repository, there is plenty of time to complete an audit, as long as we're putting compliance first and making compliance part of your business operations and strategy. Thanks everybody for listening in. Give us a like, give us a share. We'll see y'all next time.